specifically for younger folks, there's a common statement that's made is, well, I'm young, I don't have to worry about it. Now, I know, just as a personal aside, I know the data does kind of show that if you're under this age with, not morbidities, like your chances of dying from COVID are very low. But how would you address someone who says that, well, because I'm younger, I'm not old, I don't need to worry about COVID?
Yeah, I'll start. I'll say a couple things because I talk to my family members about this a lot. I think the first thing is you're right. Younger people, depending on your other medical history, right, may be at lower risk. But we see plenty of young people in the hospital who have COVID-19 and who have died of COVID-19. And so one of the things I just honestly say is, you don't know who you're gonna be. So if you have an opportunity to not risk it, then just don't risk it. So that's one thing. And of course, the other piece of this is that even if while you might not have a bad outcome if you even contract COVID-19, it's very possible that you could spread it to other people who may not be as lucky. Especially, you're right, your older family members or friends or the people that you're around. So I think the other piece of it is that you are in a position to do your part to keep the people around you safe. And what a great opportunity that is. And I even say this to people, I'm vaccinated and I still don't go to gatherings and I still don't do, um, uh, you know, kind of big events because we still don't have enough data on the vaccine about even if I'm personally protected, I could spread COVID-19 to other people. So why would I put other people at risk? The same reason, even though I have a low risk myself, I still have made a decision not to do those activities because we just don't know yet. And so I think those are the big things is that you just don't know. And I guess the last thing I'll say, as like a primary care general medicine doctor who takes care of people with a lot of chronic disease, what we've seen over time is a lot more people, and Chanel spoke to this, right? That a lot of people have chronic diseases that put them at risk for COVID-19 and having a severe infection or a bad outcome. And sometimes we don't know, right? So I think there's a lot of people walking around who have high blood pressure. A lot of people are walking around in our communities who may be, their weight might be over what's recommended for a healthy weight. And not everybody sees that as a medical problem, and yet we know that that impacts COVID-19 outcomes, right? And we know that these diseases are happening earlier and earlier. Even my pediatric colleagues are seeing this chronic diseases and high blood pressure in really young populations. And so I think those are all the things that I would tell them, which is a lot, but that's that's where I'll stop.
I think I would say a couple of things. The first is that um, we have to be more of a cooperative and collaborative society. And so we have a duty to each other, really. And this is an infectious disease. It spreads from person to person. And each of us has a duty to try not to be part of the chain, to try not to be the one who gave it to somebody. And as Dr. O says, you may be young. And so yeah, you get COVID, you might be ill, you're probably not going to die. But then what may happen to a person who you gave it to? They might die. And so I think each of us has a duty to try not to be part of the spreading of the disease. That's really the problem there. So, don't contract it, don't give it to anybody else. The other thing I thought of is, way back in the 50s when the measles vaccine first came out, um, you know, measles is generally thought of as a mild illness. You get a fever and a rash and the kid gets better. But us, the physicians, we know that there are a small number of people who are devastated, just, have terrible neurologic stroke-like complications from measles, and their life is ruined, by this. And there was one such child who uh, became sort of the poster child for the vaccine, was just really willing to be out there to show people what had happened to this particular child. And so it may not be you or the next person beside you, but somewhere somebody's going to get seriously hurt by this, right? We have lost 500,000 people who are dead. They're not coming back. They're dead because of COVID-19. And you have a duty not to be part of spreading it. I think that's something that we all have to consider.
Can I say one other
That's
thing? Oh,
yeah.
I was gonna say one other thing, and there's this other point about maybe people have heard this term of long COVID, but there's people who get the disease and maybe it is mild for them, maybe they don't have a severe course, and they obviously live, but they go on to have long-term symptoms. And even now in a research institution, we're trying to figure out, do we need to set up clinics for people who have had COVID-19 and continue to experience symptoms? And so I think the other piece, if you're not really moved by this idea that it could happen to you and you could spread it to other people, is that even if you get this vaccine and do well, you could have long-term complications that could affect the quality of your life. I mean, one of the symptoms of COVID is about affecting your smell and taste, right? And so there's people who are still experiencing problems with that, and that could seriously affect your quality of life. So I think there's things that we have to think about outside of just the immediate moment as well. So that's my last point.
That's great. I think Dr. Morgan provided a good statement. He said we have a duty to each other. And that's one of the things that actually he and I, we had some good conversations offline about this. One of the things that really motivated me to be more proactive about COVID, specifically my wife is a physician, doctor. So she actually just going to receive her first vaccine. And, obviously she's been, coaching me up. But after Dr. Morgan and I spoke, it wasn't just about me being healthy and some of the things that, I'm in good shape, I'm all this XYZ. It's if I caught COVID and, I'm around my grandmother, or I'm around someone who has, two morbidities, that person is more exposed and might not, fare the same way I would.